Was wondering, for my age and skin complexion, what would be the best way to get rid of my bags? I'm 23 years old, will be 24 in June, and I've been dealing with my eye bags since I was in high school, and over the years they have gotten worse. I've also noticed that the skin under my eyes are starting to wrinkle. What should I do about this problem? And also, my top eyelids are puffy.
Thank you for your question. You're 23 years old and you state that you've been dealing with under eye bags since you were in high school. And you become even further aware of some potential wrinkles under your eyes, and that you're also concerned about puffiness in your upper eyelids. Well, I can certainly give you some guidance as to what your situation is in the absence of a physical exam. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic and reconstructive surgeon. I've been practicing in Manhattan and Long Island for over 20 years, and helping people with bags under their eyes has been a significant part of my practice from the very beginning. So to help you first get a sense of what your situation is and why it is what it is, I'll give you a little bit about anatomy and genetics. So to begin with, your awareness since high school is very typical. And very often this puffiness under the eyes runs in families. In fact, I've operated within one family in 3 generations. And so certainly there's a genetic trait here, and clearly it's not related to aging. So what is the puffiness? Well, the puffiness is caused by something called lower eyelid fat prolapse. And unfortunately, lower eyelid fat prolapse means that the fat that's around the eyes pushes forward in a way that creates these undesirable bulges. Now, many people, especially people who are younger, first come to me after they've tried a lot of different options. They'll have tried creams and various remedies that they learned from on the internet, and invariably none of them work, and so they'll finally seek professional treatment. Now, in a situation like yours, we have to decide how to best address the fat pockets. There's 2 approaches, but I think for your skin type, a darker skin type, I would recommend something called a transconjunctival blepharoplasty. Transconjunctival blepharoplasty means that what we're doing is addressing the fat pockets from the inside of the lower eyelids. Now that may sound fairly scary and certainly off-putting, but certainly in decades of doing this, I can tell you that this procedure in my hands has been very successful. It's a local anesthetic procedure. You don't have to go under general anesthesia. And in our practice, we do it under local anesthesia with sedation. Now, this means that also you're able to recover a lot faster in our experience, and we've had patients who, within a week of the procedure, have looked like they didn't have anything done at all. Now, a lot of times people try to blend these fat pockets using fillers, and I think in your situation, even if I don't see a side view and I'm not examining you in person, I think that the puffiness is too prominent to help with fillers. A lot of times people get fillers and they end up making the bags actually look bigger. So I would recommend that you learn more about this procedure. Be mindful that your skin type is something that has to be factored in. In fact, many years ago I wrote an article called Ethnic Considerations in Eyelid Surgery to help my colleagues understand better the needs of people of different skin types. And so I think that once you find a doctor who performs a lot of cosmetic lower eyelid surgery, you'll be able to find someone who can help you with this concern. As far as wrinkles are concerned, or your upper eyelids, I think at this point don't be overly concerned. You're still very, very young in your skin. You have to look at what are you doing to help your skin. It might be something as simple as just hydration, sleep, and some good moisturizers, because certainly at 23, we're going on 24, we're not dealing with aging issues. But you may want to look at environmental and other stressors, or if you're around people who smoke. But I think that possibly you're just looking at normal, natural lines that are present, but the more you look at something, it tends to become magnified as you focus on that area. So I hope that was helpful. I wish you the best of luck. Thank you for your question.